Symptoms, treatments, and the mental side of erectile dysfunction. A complete guide. 1. Understanding erectile dysfunction and its importance. Erectile dysfunction, ED, is the repeated inability to achieve or sustain an erection firm enough for sexual activity. It affects men of all ages but becomes more common as men get older. Though often seen as a sensitive or embarrassing topic, understanding ED is crucial because it can be a signal of underlying physical or psychological health issues. Ignoring ED may delay diagnosis of serious conditions such as heart disease, diabetes, or hormonal imbalances. Recognizing ED as a legitimate medical concern rather than a personal failure encourages men to seek help and improve their quality of life and relationships. Awareness about ED helps reduce stigma, enabling men to address the problem sooner and experience better health outcomes. 2. Key symptoms that indicate erectile dysfunction. The primary symptom of ED is difficulty achieving or maintaining an erection during sexual activity. This can manifest as partial erections that aren't firm enough or the complete inability to get an erection. Other signs include decreased sexual desire, reduced spontaneous erections such as those during sleep, and frustration or anxiety related to sexual performance. Men may notice the problem happens frequently or consistently over several months. It's important to differentiate occasional difficulties, which are normal, from persistent ED, which requires evaluation. Identifying symptoms early allows for timely intervention. Tracking the frequency and context of symptoms can also help doctors tailor treatment effectively. 3. Physical causes behind erectile dysfunction. Most cases of ED have a physical origin, often linked to conditions that impair blood flow, nerve function, or hormone levels. Cardiovascular diseases including atherosclerosis, hardening of arteries, restrict blood flow to the penis, preventing erections. Diabetes can cause nerve damage and reduce nitric oxide production, essential for penile dilation. Obesity and metabolic syndrome increase risk, as do high blood pressure and high cholesterol. Hormonal imbalances, particularly low testosterone, also contribute. Lifestyle factors such as smoking, excessive alcohol use, and lack of exercise exacerbate these issues by damaging blood vessels and nerves. In some cases, medications or surgeries can also affect erectile function, highlighting the need for comprehensive medical review. The psychological side of erectile dysfunction. While physical causes are significant, psychological factors often play a major role, either independently or alongside physical issues. Stress, anxiety, depression, and relationship problems can trigger or worsen ED. Performance anxiety is a common cycle where fear of failure leads to increased difficulty achieving an erection, which then reinforces the anxiety. Mental health disorders may reduce libido and affect overall sexual function. Psychological ED often presents differently. Men might achieve erections during masturbation or sleep but struggle during partnered sex. Addressing the mental and emotional aspects is essential for comprehensive treatment. Incorporating psychological support alongside physical treatments often yields the best results. 5. How erectile dysfunction is diagnosed. Diagnosis begins with a thorough medical and sexual history, including questions about the onset, duration, and severity of symptoms. Doctors review risk factors such as cardiovascular health, medications, lifestyle habits, and psychological well-being. Physical exams assess vascular and neurological health. Blood tests evaluate hormone levels, glucose, cholesterol, and kidney function. Additional tests like nocturnal penile tumescence monitoring or Doppler ultrasound may be ordered to assess blood flow or nerve function. Open communication and honesty during assessment improve diagnosis and treatment planning. This step is critical to distinguish ED causes and design an effective personalized treatment approach. 6. Lifestyle modifications to improve erectile dysfunction. Many men see improvement in ED symptoms by adopting healthier lifestyle habits. Regular physical activity enhances cardiovascular health and blood flow, which are vital for erections. Quitting smoking helps restore vascular function by reducing artery damage. Limiting alcohol intake prevents nerve impairment and hormone disruption. A nutritious diet rich in fruits, vegetables, whole grains, and healthy fats supports overall health and weight management. Lowering ED risk. Stress management techniques like meditation, yoga, or counseling reduce psychological triggers. Even modest weight loss can significantly improve erectile function, especially in men with obesity. Consistency and patience with these changes often lead to long-term benefits beyond sexual health. 7. Medical treatments, medications and beyond phosphodiesterase type 5 inhibitors, PDE5I, such as sildenafil, Viagra, tadalafil, Cialis, and vardenafil, Levitra, are the most common treatments. These medications increase nitric oxide's effect, relaxing penile muscles and improving blood flow. They are effective for many but require sexual stimulation to work and are contraindicated with certain heart medications. Alternatives include vacuum erection devices that create negative pressure to draw blood into the penis, or penile injections that deliver medication directly to the tissue. In severe cases, penile implants may be surgically inserted to provide a permanent solution. Treatment choice depends on health status, preferences, and response. Discussing options openly with a doctor helps find the safest and most effective approach. 8. Psychological therapies and counseling. When psychological factors contribute to ED, therapy is often beneficial. Cognitive behavioral therapy, CBT, helps men reframe negative thoughts about sexual performance and reduce anxiety. Sex therapy improves communication and intimacy between partners, addressing relationship issues that may affect sexual function. Counseling can also treat underlying mental health conditions like depression. Sometimes combining therapy with medication offers the best outcomes. Encouraging men to seek psychological support normalizes mental health care and reduces stigma. Early psychological intervention can break the cycle of anxiety and restore confidence, improving both sexual function and overall well-being. 9. Partner communication, strengthening relationships through openness. Erectile dysfunction affects both partners, so open communication is vital. Sharing fears, frustrations, and expectations fosters understanding and reduces feelings of guilt or rejection. Partners who actively support each other tend to have better treatment success and relationship satisfaction. Couples therapy can facilitate honest dialogue and provide strategies to maintain intimacy beyond intercourse. Emphasizing emotional connection helps relieve pressure and creates a positive sexual environment, crucial for overcoming ED. Encouraging empathy and patience creates a safe space where both partners can navigate challenges together, reinforcing their bond. 10. When to seek medical help and long-term outlook. Men should consult a healthcare professional if ED persists for more than a few weeks or causes distress. Sudden onset, pain, or symptoms following trauma require urgent evaluation. Since ED can indicate cardiovascular or metabolic diseases, early diagnosis is important. The long-term outlook is positive for most men. With appropriate treatment and lifestyle changes, many regain normal sexual function. Ongoing follow-up ensures treatments remain effective and health issues are managed. Embracing a holistic approach that addresses both physical and mental health supports lasting success. Staying proactive and informed empowers men to take control of their sexual health and overall quality of life. If you found this script helpful, please like and subscribe for more expert insights on men's health, well-being, and lifestyle tips. Share your thoughts or questions below. Your journey matters, and together we can break stigmas and improve lives.